Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Mudras in Medicine, a role for dance in appreciating nonverbal communication in the clinical encounter. By Maheetha Bharadwaj, MD, MS, MPhil, Dipal, Nagda, MPH, and Lapika Goyal, MD, MPhil. We present a classical Indian dance piece that depicts a patient and their partner receiving a cancer diagnosis from their oncologist. The primary purpose of this piece was to provide a vehicle for patients, physicians, and caregivers to process a life-altering cancer diagnosis. The piece was choreographed and performed by two of the authors, who are medical students and classically trained Bharatanatyam dancers, and the project was guided under the mentorship of the senior author, who is a medical oncologist. Through the process of designing this project during the COVID-19 pandemic, the authors also reflect on the role of visual arts in providing a space for contemplation and in promoting nonverbal communication in the era of virtual medicine. Mudras, or hand gestures, embody one of ancient India's most visual forms of storytelling and are the threadwork of the Indian classical dance form of Bharatanatyam. Historically performed as a temple dance, Bharatanatyam serves as a vehicle for communicating and preserving narratives from Hinduism's greatest epics. Every mudra is intricately crafted and distinctly designed, with each bend of a finger and curve of the wrist representing an object, an emotion, or state of being. Mudras are interlaced with rhythmic footwork and facial expressions in Bharatanatyam, producing a language that connects the performer to themselves, to the audience, and to the story being told. The style of Bharatanatyam specifically has been previously adapted for therapeutic relief and healing among survivors of natural disasters and victims of trauma. Although some artists have explored the use of Bharatanatyam to convey medical narratives, none to our knowledge have directly covered the nuances of clinical relationships in the context of a cancer diagnosis. A few weeks after the onset of the COVID-19 pandemic, we found ourselves in an exchange of mudras over coffee on the patio. As both medical students and trained Bharatanatyam dancers, we were lamenting the difficulties of communicating to patients with masks. "He couldn't hear me," one of us expressed. After some pause, the other extended her right hand in Karutaka Mukham toward her chest, whereas her left hand, also in Karutaka Mukham, drifted toward her ear, together signifying a stethoscope. "Is this how you asked your patient if you could listen to their heart?" she asked. We both smiled. With her hands in place, she leaned her torso to the left and extended both hands in Chaturam. She painted a rectangular frame in midair, signifying a chest X-ray. In silent melody, we played call and response, gliding our hands across the table and delicately placing our fingers into mudras. As case counts ticked upward, distressing news filled our personal and professional lives, and we both found ourselves turning to mudras to express our states of emotion and responses to the pandemic. It dawned on us that dance may play a critical role in reflecting and processing difficult medical situations, especially in the isolating environment of the pandemic. We thus embarked on a project to explore the relationship between a patient and an oncologist through Bharatanatyam. Over the course of our clinical years in medical school, we collaborated with patients, clinicians, caregivers, and artists to choreograph this Bharatanatyam narrative medicine project. Mudras were combined with facial expressions, eye movement, and footwork to craft a narrative between a patient, a doctor, and a caregiver in the setting of a cancer diagnosis. In what follows, we describe our choreographic process, the resulting narrative, and key takeaways from this artistic exploration. We propose a role for Bharatanatyam and other visual arts in enabling both the performer and the viewer to process narratives of cancer, suffering, healing, and hope. We further use this piece as a call to reclaim the importance of nonverbal communication in the therapeutic relationship, developing and choreographing the narrative. We first reached out to several physicians to help develop a medically accurate narrative. Our clinician collaborators included an oncologist who specializes in cholangiocarcinoma, a hematology-oncology fellow, 2 head and neck surgeons, and a palliative care physician. Our patient and caregiver collaborators included 3 patients undergoing treatment for metastatic cancer and 2 parents. Through multiple conversations with these partners, we developed our narrative. For musical and artistic input, we partnered with Indian Raga, an organization dedicated to the celebration of South Asian art and music. Indian Raga developed a musical score for the piece, provided a dance collaborator, and offered creative feedback on our choreography. Our choreographic process was iterative, as we moved from the dance studio to conversations and back again to the dance studio. We incorporated the feedback from our collaborators into our storyboard and our final choreography. We recorded the performance on March 31st, 2021 at the Cambridge Community Center for the Arts in Kendall Square. The dance narrative. A video of the performance can be accessed at https://YOUTU.be/NRU_N_WII_DXK. Our narrative details the journey of receiving and processing a cancer diagnosis and features 3 members of the therapeutic triangle: the patient, the caregiver, and the physician. Part 1. The diagnosis. The first part opens with a couple that, amid a jubilant celebration, receives an urgent phone call to present to their doctor's office. At their appointment, the physician performs a history and physical examination and subsequently prepares to disclose the patient's diagnosis of a worrisome mass visualized on a chest X-ray. We drew from mudras in the existing Bharatanatyam repertoire to depict clinical objects. For instance, a stethoscope was depicted using karakamukam as the earpiece and the bell, whereas an X-ray was depicted by drawing a square in the air using chaturam. Part 2. The malignancy. The second section represents an interpretation of the physiologic growth and uncontrolled spread of malignancy. Our change into red-colored garb signifies a switch in character from representing 3 individuals to 3 cells. At the beginning of this section, the 3 cells are depicted as physiologically normal, dancing in unison with each other. Their uniform vitality is demonstrated with the Suchi and Alapadma mudras. One cell undergoes a somatic mutation and becomes malignant, gaining ruthless vigor in her dance form. We demonstrate rapid replication of the malignant cell with the mudra karakamukam. As the malignant cells continue to replicate, they pull resources and grow in their harsh dynamism, portraying the unchecked growth potential of cancer cells. Although the choreographic intention of this section was to represent growing malignancy, many of our reviewers provided varying interpretations, including a depiction of the patient's inner anxieties, the therapeutic fight against the cancer, and the turmoil of treatment resistance. Part 3. The emotion. The third and final section returns to the patient, doctor, and caregiver. Here we explore as they come to terms with the gravity of a cancer diagnosis. Each has their own moments of grief, fear, recognition, and solidarity. The caregiver expresses concerns of the patient passing, and the doctor struggles with her ability to offer hope. The patient is overwhelmed with denial, anger, and grief. The piece ends in a message of unity as the patient, doctor, and caregiver embrace their role in this shared journey. Reflections. What began as an exchange of mudras over coffee blossomed into a reflective process to understand the role of Bharatanatyam within the therapeutic triangle of the patient, doctor, and caregiver. Witnessing how reviewers who were unfamiliar with Bharatanatyam responded to our narrative dance piece shed light on common themes that emerged from engaging with this piece. Here we describe 2 key takeaways that surface through our own reflections and discussions with members of the medical community. First, we were reminded of the role that visual art holds in promoting self-reflection and empathy for all members of the therapeutic relationship. Second, facial expressions and body language from the dance narrative resonated with the experience of oncologists and patients in the clinic. The repeating motif of body language served as a critical reminder of the role of nonverbal communication in the therapeutic relationship. In the era of virtual training in medicine, we use performative arts as a reminder to deliberately preserve nonverbal communication when interacting with patients. Visual arts as a space to process, reflect, and empathize. Our dance narrative received a range of interpretations, only some of which matched our original intention. These similarities and differences in choreographic intention and audience interpretation demonstrated the power of visual arts in both representing universal emotions and reflecting one's personal experiences. For us as choreographers, the dance studio became a space for contemplation and healing. We dissected the impact of illness on the human body, adjusting our limbs and contorting our faces to embody raw human emotions of pain, anguish, and resilience. As viewers, patients and physicians also expressed moments of reflection while processing our piece. For example, many physicians discussed how the piece reminded them of the personal toll that repeated delivery of bad news can take on them as a clinician. Although one clinician thought that this difficulty in delivering bad news was best represented by the emotional end of the piece, another felt that this internal turmoil was better portrayed through the middle section that consisted of more intense footwork. Engaging with our dance piece encouraged viewers to recognize certain universal clinical themes while also providing room to reflect on nuanced personal experiences. As a broader entity, visual arts have often been underrepresented within the field of medical humanities. Searching the literature for examples of visual arts curricula across medical schools across the United States yielded a plethora of prose and painting-based visual arts curricula, yet very scarce incorporation of movement-based art. We propose that dance plays an important role within medical humanities curricula in understanding illness, emotions, and empathy. Movement-based arts promote a sensory experience of illness and an expression of physical and emotional states that cannot be conveyed through words alone. With more medical training programs embracing humanities in clinical training, we attest that the visual arts, particularly movement-based art, should also be considered. Recognizing the value of nonverbal communication. As the COVID-19 pandemic progressed, virtual medicine replaced in-person encounters, and masks grew to be a necessary component of the hospital environment. Like many, we encountered muffled words and frozen facial expressions on Zoom. Faced with a dramatic change in verbal communication as medical trainees, our choreography unfolded into an exploration of the ways in which physical space, facial expression, and hand gestures enhance the clinical relationship. Early in our choreography, we shared a rehearsal video with our collaborators. Although all immediately recognized the role of the patient and the doctor, several felt that something critical was missing. One patient felt that the physical distance between the doctor and the patient was too great, and one physician pointed out the lack of compassionate physical contact by the oncologist. Inspired by these conversations, we re-entered the dance studio and experimented with the physical space our bodies occupied. We explored nonverbal ways to convey care and concern. In our choreographic revision, we had the doctor place a hand on the patient's shoulder when she was coughing, and we incorporated a stool to follow the provider to be eye level with the patient and increase the portrayal of open communication. Intentionally incorporating the empathetic touch into our choreography increased the perception of care between the doctor and the patient. In a time where we are forced to embrace virtual care and communication, our choreographic process reminded us of the critical role of nonverbal communication in the therapeutic relationship. We found that physical space, facial expressions, and eye contact are just as integral in the clinical encounter as they are to Bharatanatyam. What we have lost through the screen is the unspoken care held in the extra moment of eye contact, the supported forward lean of the torso, and the comfort of a hand on the shoulder. These wordless extensions of care are a cornerstone of patient satisfaction and the therapeutic alliance. With masks and virtual visits becoming potentially permanent fixtures in medicine, we highlight the importance of trainees and clinicians being deliberate and using nonverbal communicative techniques in caring for patients. In our exploration of Bharatanatyam within Western medicine, we found that ultimately the qualities most coveted in a dancer and a physician are one and the same: a broad understanding of the human body, a deep sense of empathy and humility, and a profound commitment to using body language to support the journeys of themselves and those around them.
Hello and welcome to JCO's Cancer Stories, the Art of Oncology, brought to you by ASCO Podcasts, which covers a range of educational and scientific content and offers enriching insight into the world of cancer care. You can find all ASCO shows, including this one, at podcast.asco.org. I'm your host, Dr. Lidia Schapira, Associate Editor for Art of Oncology and Professor of Medicine at Stanford University. Today we are joined by Dr. Dipal Nagda, medical student at Harvard Medical School, and Dr. Maheetha Bharadwaj, urology resident at the University of Washington. In this episode, we will be discussing their Art of Oncology article, Mudras in Medicine, a role for dance in appreciating nonverbal communication in the clinical encounter. At the time of this recording, our guests have no disclosures. Dipal, Maheetha, welcome to our podcast and thank you for joining us.
Thank you for having me, Dr. Schapira.
Thank you for having me. It's a pleasure to be here.
So tell us a little bit about the origin for your narrative. You told us about your collaboration in dance and your appreciation for what movement and dance can bring to self-expression and to the clinical encounter. But let's start by hearing what brought the two of you also to collaborate on a narrative, a written piece.
I'm happy to get started on this one. So Maheetha and I met our first year of medical school, and we hit it off right away for a variety of reasons, one of which was that we both shared a training in Bharatanatyam. And so we had actually performed early in our first year of medical school a piece for a local performance at Harvard. And then around the start of the COVID pandemic, which was about 2 years into our second year of medical school, right in the middle of our clinical rotations, we both found ourselves pulled from the clinical environment with a lot of time on our hands. And as dancers do, we both turned to dance in our own ways and collaboratively to try to find a way in which to channel some of the feelings and emotions that we were having into a creative, performative piece. Maheetha, I don't know if you have anything else to add to that.
Yeah, no, I think that sums it up pretty well. Just one thing to add is that both of us remember kind of talking to each other about how when we came back from COVID, right around June of 2020, our clinical experience had changed dramatically in that masks were now mandatory. And I distinctly remember thinking about how it was hard for me to hear this one patient who was this 90-year-old woman, and she was a little bit hard of hearing. And I just remember feeling that that encounter was just so much more difficult. And people and I have been talking about encounters like these ever since we came back after the first surge of the COVID pandemic. And I think just all of that also kind of led to this idea for this project.
And so the project starts with the two of you who are dancers and very aware of the power of movement, again, just for yourselves, right? And you're now thinking about exploring that as a narrative or as a story. And you chose cancer as your example. What path led you to cancer?
I think cancer is a disease that can affect everyone. And I think I personally have had family members affected by cancer. My mom is a palliative care physician. So talking about cancer and cancer-related illnesses is not new for me and my family. And on top of that, I think the emotional impact of having such a life-altering illness is something that I think was deeply affected by COVID. We saw that patients weren't coming into the hospital, patients from a surgical perspective, patients weren't getting the treatment that they needed, and those treatments were being put off. And I think that adds a wealth of anxiety to an already very stressful situation. So I think, for both of us, I know that Dipal is really interested in oncology at the moment, and me as a, urologist interested in uro-onc as well. I think that topic really hit home for both of us. And I think it was a great way to kind of also explore the different types of emotions that someone might feel with a life-altering illness.
So did you co-create the scenario, the narrative?
Yes, we did.
Yeah, so I would agree with everything that Maheetha said. And in addition, I think when we were originally thinking about this, we were thinking about dance in the setting of a patient-doctor relationship. And so when trying to map out the numerous patient-doctor relationships that exist within the field of medicine, I think both of us felt that within oncology specifically, there is that longitudinal component, and there is that, as Maheetha mentioned, that deeply emotional piece, not only for the patient, but for the physician as well, and caregivers. And while that definitely exists in other fields, I think within oncology was one that we felt would really come alive in a dance narrative to both explore that collective journey of the patient, doctor, and caregiver, and the individual journey of each of those three individuals.
Well, I can speak for the readers of Art of Oncology and say that we don't disagree with you. We totally agree that there are very strong bonds and that there's an emotional resonance to being professional caregiver and, of course, of the patient and family members and family caregivers. So kudos to you for recognizing that. How does movement affect communication? And how did the experience of that additional layer of isolation and perhaps masking and distancing during COVID affect your entry into this world of medicine and cancer medicine?
That's a great question. First, I think for my specific clinical rotations, I was in an ambulatory predominant clinical rotation site. And so a lot of the interactions that I was having in my early clinical years were via virtual patient interviews. And I think that is a place where movement really came out. And I found myself turning to hand gestures. And I also found that there was a certain distance via Zoom that the clinician and the patient were trying to overcome that isn't totally, from what we found through this piece, able to be overcome through Zoom. And I think that was really perspective changing in terms of realizing the value of movement and the value of proximity and, the distance and the ways in which eye level and body gestures and, physical contact really impact that relationship.
I read in your narrative and in watching your video sort of the lament for not having the ability to move and touch. And I am very happy that you're able to express that. And I hope that now that things are more normal, that you have gone back to feeling that you're freer to connect with patients and with your colleagues, even through facial expressions and touch. And so tell me a little bit about how you view movement as a potential tool in your therapeutic connections with patients going forward at this early stage of your careers.
I think that's a fantastic question, and a question that's really important because in medical education, we often talk about the art of medicine, which I think, cannot be emphasized more in this time of wearing masks in hospitals. And just as Dipal had said, I also found myself with patients compensating for wearing masks. Patients often ask, are you smiling under that mask? Are you frowning under that mask? I can't tell. And the ways in which we compensate, which is coming down to the level of the patient. So sitting down in a chair or sitting down at the edge of the bed with the patient's permission. In pre-op sometimes, and I actually remember distinctly doing this the other day. I was on the colorectal service, and oftentimes colorectal cancer is diagnosed in one day, in 1 week, and then you have the surgery 2 weeks later. And patients are just kind of taken for this whirlwind of emotions while they're contemplating, chemotherapy versus surgery and before and after the surgery. It's almost everything happens so quickly. And in pre-op, during the pre-op time before they go into the procedure, it's amazing how much as medical students, having been working in these environments with masks, we have adapted to be able to recognize when someone is anxious, nervous, crying, not crying, sad, happy. And I distinctly remember this one patient who was very clearly nervous. And I just took a little bit of time before signing her in, checking her consent forms. I just said, "Hey, how are you? Are you okay?" And the gesture was going to her bedside, just laying an arm next to her hand, in between her hand and her blanket, and saying, "Are you okay?" And immediately this patient kind of burst into tears. And she said, "I'm not. I was just diagnosed last week. And next thing you know, surgery is this week." And it's just because the masks are there, it kind of makes me be more aware of what the patient is feeling because I can't immediately tell. So now I'm thinking about it a lot more, and I'm trying to understand it a lot more. I'm paying more attention to it. And the ways that we compensate is trying to bring our physical bodies a little bit closer to the patient in order to compensate for the distance brought into that rapport by the masks. And I think that's really, really crucial.
It warms my heart to hear you talk like that, because instead of viewing this as an impediment, you work extra hard to try to understand the emotion that your patient is feeling, to connect with her or him in that circumstance, and to show some humanity. And it's amazing how much comfort that can bring to a person who is feeling extremely vulnerable and anxious.
Yeah. And I just want to add that, I had been taking care of this patient after her surgery for the entire week. I was rounding on the weekend as well, and we discharged her on a weekend. And as I was giving her discharge papers, she burst into tears again. And she said, "It was lovely seeing your face every day. I look forward to seeing your face every morning. It's nice to have that continuity of care." And I did feel that pre-op interaction made a difference. It 100% made a difference in how she viewed us, our care, and the hospital system itself.
So bottle that feeling, and on a bad day, bring it out, and it'll carry you through some of those more difficult moments in medicine. So tell our listeners a little bit how the two of you took your dance to a written narrative.
Absolutely. So actually, originally when we came up with this idea of a dance, we did not think about sort of the next steps from that original dance narrative. And when we started to show it, our piece and our choreography, to different physicians, but more importantly, I think the patients and the caregivers who watched our piece, who had so much, not only input and feedback for us, but their own reflections and their own takeaways. And what was incredible was their own interpretations. That really took us for a surprise, is people find different pieces of the visual arc of our dance piece to relate to comment on, to, help us improve. And I think Maheetha and I both realized that the benefit of visual arts, specifically this dance piece, wasn't just from doing the dance itself, but from interacting with the wider community of people who are either watching our piece or providing feedback. And that sort of bridged for both of us this idea of, let's try to put all of these things that we're feeling into words, into concrete ways in which we can use visual arts broadly in medical education.
And what was your relationship to the third and senior author in your paper, Dr. Goyal?
Dr. Goyal has been incredibly supportive throughout this entire process. I think early on, Dipal and I were looking for mentors who are familiar with Indian classical dance, familiar with Indian culture, but also had a strong passion for narrative medicine, for understanding and improving upon empathetic care for patients. We searched and emailed many mentors, all of whom gave us valuable feedback, and we've acknowledged in our acknowledgement section. But Dr. Goyal, for us, really took our vision under her wing and said, I think what would be great is if you could show the beginnings of your narrative, whatever rough choreography you have, to patients. And she helped us connect with some of her own patients to be able to give feedback on the narrative and improve the narrative to be perhaps more all encapsulating, more relatable to a wider group of individuals, to tweak the narrative itself a little bit. I think she's been incredibly instrumental in helping with that, but also shaping, our narrative as well, and kind of pinpointing what exactly do we want to convey and what do we want to tell people? What do we want to tell the world?
So what is the take-home message from your narrative?
I think for me, beyond the scope of what we've written, this project for me really served as a reminder of the things that matter to me outside of the clinic, and how all of those passions that we have, for Maheetha and I specifically, dance, really not only provide us a reflective outlet outside of the clinical environment, but I would argue enhance our performance as doctors, our relationships with our patients, and I think truly contribute to the clinical environment as well. So I think that's a personal takeaway for me, and a really important reminder as I think about applying to residency and the next step of my life. But then I think broadly, as we, are starting to recover from the COVID-19 pandemic, and we're thinking about how to deliver care in both measurable and non-measurable ways, I think there's parts of the clinical environment that matter so deeply that we don't always think about. And for us, it was really nonverbal communication and body language, and how to keep that authenticity alive. And how do we, if we know, as medicine turns more and more to virtual care, how do we train the next generation of medical providers to really keep some of those aspects of body language and eye contact and nonverbal communication really alive in virtual delivery of care? And so for me, that was sort of the broader call to action.
Any plans to do more pieces?
Absolutely. I think this is just the beginning. And Dipal and I have already talked about different topics that we could do, particularly because Bharatanatyam, which is the style of Indian classical dance that we have used to choreograph this narrative, has always been heavily tied to religion. And now in the modern days, we're seeing the secularization of this art form, or in other words, the use of this art form and other Indian classical art forms to depict and portray more secular pieces that convey aspects of human life that aren't necessarily connected to religion. And I think that's incredibly important. And narrative medicine is a field of its own that I think is very important in order to, as Dipal said, kind of craft the art of medicine within you and within each clinician. And so we've definitely talked about, for example, having stories about COVID, potentially having stories about erectile dysfunction, topics that aren't necessarily talked about on a day-to-day basis, but are relatable to each of our fields in different ways. And I think the goal of that is to be able to reach people, to be able to talk about topics that are important to people, but people don't have, awareness of, to increase awareness, education. And I think there's many avenues we can take. This is just the beginning.
Well, it's been a pleasure to work with both of you. I'm very impressed by what you have already accomplished. I love hearing your humanistic visions for what good medicine is and your contributions to the art of medicine. So thank you so much. Until next time, thank you for listening to JCO's Cancer Stories, The Art of Oncology. Don't forget to give us a rating or review wherever you listen. Be sure to subscribe so you never miss an episode. JCO's Cancer Stories, The Art of Oncology is just one of ASCO's many podcasts. You can find all of the shows at podcast.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.